The main findings from this week's analysis is concentrated in several areas. First, I think we're seeing evidence in Scotland particularly, but also England, that even in a moderately vaccinated population, B617.2 is transmissible enough and has enough immune escape, at least from AstraZeneca, that we're seeing quite rapid expansion of transmission. So that'll be a place to watch very closely and may be a marker for what happens in other countries that have used AstraZeneca or have used some of the other vaccines that are not as effective against the escape variants as the mRNA vaccines. The second area that I think is of huge concern is the really rapid increases in select countries in Africa. These include Uganda, Zambia, DRC, a little less rapid, but still substantial increases in Namibia. And these definitely raise questions as to whether these are surges driven by 617.2, or in the case of Namibia, is it just what's happening in neighboring South Africa, which is the seasonal, heading into peak seasonality, and it's a still 351 driven surge. Elsewhere in India, the pandemic continues to decline. We're seeing some suggestion that lockdown and other measures in Taiwan, for example, is leading to a peaking of transmission there, which is important because it suggests that the same measures that we've used throughout the pandemic work, including against 617.2. And so that control of transmission in Taiwan, I think, is also somewhere we'll want to watch very closely. In Latin America, in Chile, another warning that some vaccination coverage where they have 80% with one dose, so very high vaccine coverage. They're still seeing quite steadily rising cases. That could be low efficacy of the vaccine against P1, which is still the major variant, we think, in Chile. And then generally the Southern Hemisphere is starting to climb again, as we would expect. And in the rest of Europe, and actually the US and to some extent Canada, I think we're seeing that seasonality is is very strong. So, because we're seeing declines that are in some sense beyond what we would expect just from the scale up of vaccination, because they're happening throughout, for example, Europe, when there's really marked variation in vaccine coverage from east to west. So those are the major highlights that we're seeing.